Good morning, ladies and gentlemen. This is Aisha Sheikh, a health coach from the National Health Insurance Company, Daman, and I am part of the disease management team. Thank you for joining us today in Prostate Cancer webinar. Prostate Cancer Awareness Month is observed every year in September by health experts, health advocates, and the public to raise awareness about prostate health and prostate cancer. It is a time to help people learn about it and support those who are affected by it. In today's webinar, we are going to shed light on one of the most common types of cancer that affects men, which is prostate cancer. It's our pleasure to have Dr. Aatif Sheikh from Mediclinic Hospital to take us through this journey. On a side note, please note that you can send your questions through the Q&A chat box anytime during the presentation, and we will allocate 15 minutes at the end of the session to answer these questions. Without further ado, let me introduce our presenter for the day, Dr. Aatif Sheikh. He is a specialist urologist with more than 13 years of experience in the assessment, diagnosis, and management of all major urological conditions. He worked as an assistant professor and consultant urologist in leading medical institutes and has authored medical papers and reported several interesting cases in prestigious medical journals. In addition to being a member of the Royal College of Surgeons in Ireland. Dr. Atif, welcome. You may start.
Thank you, Aisha, for a very nice introduction. Thank you, Daman, to give me a privilege to talk about men's health and prostate cancer awareness webinar. So I'm going to share my slide. Okay, I'm working in Mediclinic Airport Road since last 9 years. So I'm doing all kind of procedures. So I will start. Today's objective of the talk is first of all to highlight the health problems in men. I will then discuss the importance of early detection of diseases by means of screening with a special focus on prostate cancer. Lastly, we will briefly talk about the reproductive and sexual disorders affecting males. So common problems that can affect males include cardiovascular diseases such as hypertension, or commonly called high blood pressure, high cholesterol, obesity, and the risk of heart diseases, example heart attack and myocardial infarction. Diabetes is also a common condition that in fact taking a form of a global epidemic thanks to our lifestyle and dietary habits. Common cancers in male include cancers of the lung, intestine, prostate. Then there are mental and reproductive health issues which are increasing incidence because of the stressful lifestyle and changes in the society. So there are certain risk factors which we can avoid by ourselves, like obesity, stress, smoking, diet. We should avoid high salt and high sugar intake in our daily lifestyle. Sedentary routine, we should have to do exercises, personal hygiene. There are certain risk factors which we cannot avoid, like age, gender, and our genetics, which we are getting it from fathers and forefathers. So in this diagram, you can see that we have to screen certain population. We don't have to screen all the male population. By screening, we will select some patients to whom we have to do further more testing to advise treatment or not to advise any treatment or just to follow up for them. Now I will talk about the important aspect of screening. So I will discuss how an individual has to be screened for cardiovascular risks and cancers. Then I will discuss in bit detail about the prostate cancer, that what it is and how it presents and how early screening and detection can make a big difference. Cardiovascular risk assessment should start by the age of 18 years. Like for hypertension, we have to start screening at the 18 years. Further screening is based on the initial results and other risk factors such as presence of diabetes, obesity, family history, etc. Similarly, lipids are checked once between 17 to 21 years of age, and further testing depend again on the risk factors. Diabetes and obesity, as I mentioned earlier, are nowadays epidemic. So as yearly assessment is warranted, especially in high risk population. According to the American Cancer Society, after prostate cancer, four more common cancers are lung, colorectal, bladder, and melanoma. There are certain general rules and advice for cancer prevention that basically focuses on healthy lifestyle, like avoid smoking, quit alcohol drinking, maintain a healthy weight, do physical exercises at least 3 times per week, increase intake of fresh foods and vegetables, and protect against sexually transmitted infections. For colorectal cancer, screening should start by the age of 45 years and continue every 10 years, or more frequently if there is any change in the risk factors like blood in the stool or anything like that. The screening gold standard is colonoscopy, although occult blood or quick test in the stool can also be looked for an initial screening method. For lung cancers, the high-risk groups are the smokers or former smokers who have quit the smoking since in the previous 15 years. For the lung cancer, screening should start by the age of 50 years and continue till 80 years. Every year, they have to do a low-dose helical CT scan. Now, the main topic, the prostate cancer. I will talk in detail about the prostate cancer, why it is important, what are the presenting symptoms, who should be screened, and what are the screening tools. I would also briefly discuss the management options and prognosis of the disease. As you can see this diagram, this is the bladder, this is the bladder neck, this is the urethra, and this is the prostate. And this is the prostate cancer, the pictorial view. You can see that almost prostate cancer happens to have in the periphery of the prostate. So most likely whenever it is growing, it doesn't cause any symptoms and it presents silently. So this is the reason why screening is most important. What is prostate? Basically, prostate is a muscular gland that surrounds part of the urethra, located directly beneath the bladder and in front of the rectum. Its main function is to produce semen. If it gets enlarged, it can obstruct the passage of urine or semen through the urethra. Normally, it enlarged because of the aging. It can be enlarged because of the cancer of prostate. There are other diseases of the prostate like prostatitis, acute as well as chronic. So why the prostate cancer is so important? Question is, prostate cancer is the most common cancers in the men worldwide, with an estimated 1,600,000 cases and 366,000 deaths annually. In United States, 11% of the men are diagnosed with prostate cancer over their lifetime. Even in UAE, this is the taken from 2020 to 2020 United Arab Emirates slide, in which you can see that prostate is 12%, prostate cancer is 12% in the men population. So how prostate cancer presents? As I've told you, majority of the prostate cancers are asymptomatic because they are in the periphery of the prostatic gland, so they cannot produce any symptoms, so diagnosed on screening. And this is the reason why screening is so much important. Some patients may present with non-specific urinary symptoms like blood in the urine or blood in the semen. However, most of the time the cause is something else and it's not the cancer itself, and diagnosed to find out that cancer is also harboring in the prostate in those patients. Patients who have more widespread disease may present with bone pain or more commonly back pain due to spread of the vertebra, generally weakness, anemia, and weight loss. So how to diagnose initially? The initial workup includes the simple blood test, which is called the serum prostate specific antigen, and digital rectal examination of the prostate. Prostate specific antigen is often raised in prostate cancer, but a raised level does not always mean cancer. Similarly, a normal PSA does not clearly rule out prostate cancer. So any PSA result should be considered in context of other investigations and clinical examinations. And this is the reason why there are different kinds of PSAs. There are PSA, total PSA, there is free PSA, there is a ratio of the PSA, PSA density, PSA velocity, according to the race, according to the size of the prostate, because the PSA sensitivity is around 45 to 50% and PSA specificity to diagnose prostate cancer is 45 to 50% again. The examination which we are doing is the digital rectal examination, the finger examination. It helps to determine the consistency of the gland, presence of any nodule or induration or asymmetry should be further worked up or established to diagnose, but DRE generally is not a good modality to diagnose prostate cancer. But we can find out asymmetry, we can find out nodules, we can find out rectal mucosa is mobile over the prostate, median sulcus is palpable, finger is blood stained or not, we can reach up to the upper limit or not. So still it's not obsolete. The imaging modality to diagnose is transrectal ultrasound is often used to evaluate abnormalities detected on DRE, digital rectal examination. However, even if TRUST does not show concerning findings, prostate biopsy is warranted if indicated based on other factors like raised PSA or digital rectal examination finding. Because TRUST misses a substantial number of tumors. Prostate MRI is increasingly being used as an adjunctive tool in refining risk factors for clinically meaningful prostatic disease and to inform decision for performing prostatic biopsies. PSMA, prostate specific membrane antigen positive emission tomography PET scanning is becoming the most widely available in the United States and Western countries and most sensitive and specific than the other PET scan techniques. Local disease within the prostate can be demonstrated on PSMA scan in some cases. On that basis, we have to go for the transrectal prostatic biopsies. Basically, there are three ways of doing a biopsy. Transurethral method. In the olden days, we were doing it. In some cases, still we are doing transurethral biopsies if there is any indication of cystoscopy. Transrectal prostatic biopsy was famous and in the guidelines till 2021. Because of the risk of sepsis, because of the risk of severe infection, out of 100, one will have this kind of infection. So transrectal method is not in the guidelines. It's the category 2 in 2022 American Urological Association guideline and EAO guidelines. Nowadays, perineal method, transperineal method of the prostatic biopsies are to be done because of less septic risk. So how to manage once we diagnose the prostate cancer? Management depends upon active surveillance. Because this cancer is the slowest growing cancer of the body, so we have to see if the patient can survive 10 years or not. If we think that yes, patient can survive 10 years, then we have to offer the other therapies like brachytherapy, radiation therapy, chemotherapy in advanced stages. If not, then active surveillance can be the treatment modality. So the question is, to whom we have to screen and how to screen? The answer is men at risk should be screened. Most important risk factors is increasing age. Prostate cancer is rare before 45 years of age. The risk is higher in African Americans and people with certain genetic mutations like HRBA1 gene and HRBA2 gene. There is an increased risk associated with use of animal fats, increase of alcohol use, and smoking. There is association of prostate cancer with physical inactivity as well as obesity. There is an emerging data about the increased risk with men becoming fathers with IVF techniques as well as vasectomy. However, these results are still limited to certain centers and require further research. Screening can be initiated at the age of 50 years for average risk persons. However, for high risk males like African Americans or with a first degree relative family member having a cancer of prostate, start screening at the age of 45 years. PSA testing alone is the most appropriate test for screening. Suggested screening interval is 1 to 2 years. Men with a PSA level above 7 nanogram per milliliter should immediately refer to the urologist. For a man with a PSA level between 4 and 7 nanogram per milliliter, repeat the PSA testing in 6 to 8 weeks. A repeat PSA level greater than 4 nanogram per milliliter should be referred to a urologist for a further evaluation. Now I would love to discuss reproductive health issues in men. The most common issue seen in the clinical practice is reduced libido. Libido is desire to do sexual activity, various forms of erectile dysfunctions, as well as male infertility and premature ejaculation. Libido declines with testosterone deficiency, stress relationship issues, depression, and systemic illness. Additional causes of low libido include some medications such as certain antidepressants, opioid analgesics, and certain hormone blocking drugs. Other causes are alcoholism, fatigue, recreational drugs, other sexual dysfunction, and other hormonal conditions such as hyperprolactin and thyroid abnormalities. As far as erectile dysfunction is concerned, majority of them are psychological causes. 95 to 96% cases are psychological. The risk factors for erectile dysfunction include cardiovascular diseases, diabetes mellitus, hypertension, obesity, dyslipidemia, smoking, and medication use. Cardiovascular diseases, diabetes mellitus, hypertension, obesity, dyslipidemia are not only the risk factors, but they may be an early warning signs for future cardiovascular events. Literature proves that erectile dysfunction happens 2 to 3 years prior to having a major cardiovascular event, so should not be ignored. Smoking may be an independent risk factor for an erectile dysfunction. Depression, stress, relationship issues are commonly associated with erectile dysfunction. There is a possible but controversial association of erectile dysfunction with the bicycling, especially with having a long nose, which compresses the blood flow to the local artery, which can result in penile numbness and impotence. So how to treat erectile dysfunction? The treatment is based on the cause. For example, we have to treat the cardiovascular conditions to treat hypertension and testosterone replacement in case of hypogonadism. If the cause is hypogonadism, the management also includes the use of medications such as 5-PDI inhibitors, 5-phosphatidylserase inhibitors like sildenafil, tadalafil. Other effective therapies include intraurethral creams, self-injections in the corpora cavernosa, vacuum devices. For men who don't respond to these modalities, penile injections and vacuum devices and penile prostheses can be the treatment modality. Ejaculatory disorders are a heterogeneous group which includes retrograde ejaculation, premature ejaculation, retarded ejaculation, and failure of ejaculation, which is called anejaculation. Factors thought to be associated with ejaculatory dysfunction include low serum testosterone concentrations, low urinary tract symptoms in older men, some drugs like alpha blockers, example tamsulosin, and antidepressants, example paroxetine. Surgery for benign prostatic hyperplasia commonly results in retrograde ejaculation, whereas radical prostatectomy results in anejaculation. The treatment is stepwise. First, we have to give antidepressants, then local anesthetic creams and drugs, and then psychotherapy and behavioral therapy. Another topic that warrants discussion is sexually transmitted infections, STIs. These are the conditions that are caused by transmission of an organism between sexual partners through different routes of sexual contact, either oral, anal, or vaginal. The highest incidence is between the ages of 15 to 50 years of age. All sexually active individuals are at risk. Prevalence is highest in females less than 25 years old, men who have sex with men, patients with HIV, and individuals entering into correctional facilities. The common sexually transmitted infections are syphilis, chlamydia, gonorrhea, trichomoniasis, genital herpes. Majority of them presents with dysuria or urethral discharge, some with presents with penile ulcers and painful ejaculations. The management again depend upon the cause and the type of the sexually transmitted infection. Most diseases are to be notified to the Department of Health, and also the partner needs to be notified, tested, and treated. Retesting is performed 3 months after the treatment or at the first follow-up visit thereafter during the year following treatment. The most important is male infertility. Infertility is defined as inability of the couples to have a baby after 1 year of unprotected sexual intercourse. It affects 10 to 15% of the couples. Male factors responsible for approximately 20 to 30% of all infertile cases. The diagnosis of infertility in men is mainly based on semen analysis. The main parameter of semen includes semen volume, semen concentration, appearance, viscosity, motility, morphology, and vitality. In almost 40% of the infertile men, there is no clear etiology. However, there can be certain factors that can affect fertility, for example, hormonal deficits, physical causes, sexually transmitted problems. Hormonal causes include the lack of gonadotropin releasing hormone or lack of testosterone that results in reduced or absent sperm production. Physical problems like enlargement of the sperm vessels, known as varicocele, is one of the most common male infertility problem. And treatment is very easy. We have to do a varicocelectomy. Damage of testes due to torsion as well as genital tract infections like mumps can also result in male infertility or subfertility. Erectile dysfunction, commonly known as impotence, and other ejaculatory disorders can also be responsible for infertility. Other factors include exposure to hazardous substances like solvents, insecticide, adhesives, silicone, and radiation. Exposure to radiation can lead to complete infertility. Overuse of sun bath and hot and cold water bath can also lead to subfertility. Some occupations like driving and some occupations having dealing with high temperature like bakeries can cause infertility. Poor nutrition and chromosomal abnormalities can also lead to subfertility or infertility. So what we are looking in semen analysis, we have to look for the volume. The normal volume should be around 1.5 to 5 milliliter. We have to see the viscosity. Viscosity should not be viscous. It should liquefy within 30 minutes interval so that the microscopic examination can be done. We have to look for the morphology. A normal sperm should look like this. This is the head, this is the mid piece, this is the tail. If there is any abnormality in the head, if there is any abnormality in the mid piece, if there is any abnormality in the tail, it counts in the morphology. Then we have to see the motility. The fastest motile sperm should win the race. Ideally, it should be around 35 to 45% of the sperm should be rapid motility should be there, and 15% linear motility. Then we have to see the count. Count should be around more than 15 or 20 millions per milliliter. If it is less, then it is called oligospermia. If there is no, then we have to call azoospermia. So what is the treatment? The treatment for infertility depends upon the cause. As I've mentioned, the most common cause is varicocele, so we have to do the varicocelectomy. Gonadotropin releasing replacement therapy for the persons who have gonadotropin replacement deficiencies. Assisted reproductive techniques can be used if sperm are retrievable from the testes, epidermis, or ejaculate. Assisted reproductive techniques may result in live births. It can bypass all the defects independent of the cause of the infertility and is the only potential effective treatment for most causes of the male infertility. By this, I will say thank you to my audience, and the floor is open for the questions. I'm ready to answer all the questions. Thank you.
Thank you, Dr. Aatif, for such an informative presentation. We have a couple of questions here. So, yes, for our first question, is varicocele leads to prostate cancer?
Sorry, say it again.
Is varicocele leads to prostate cancer?
Normally not. Prostate cancer will never be because of the varicocele. Varicocele causes sperm deformities. Okay, so there are different stages of varicoceles. Varicocele is very common. If I will give you an example, if I'll go to any park or any area, and if I will do a clinical examination, out of 5 males will have, out of 5, 4 will have the varicocele of grade 2. So there is subclinical varicocele, there is grade 1, grade 2, grade 3, grade 4, and grade 5. Grade 4 and grade 5 varicoceles warrant operation if on the basis of 4 indications. Number 1, if there is subfertility, if we'll do the semen analysis, and if the patient is not able to pregnant his wife, if it is causing pain in the testicle, then we have to do a varicocele operation. And or third thing is that if the patient or the patient partner says that no, I don't feel the good because of the swelling of the varicocele, then we have to do the operation. Otherwise, varicocele operation is also not necessary. For example, if the patient is married and having 5 or 6 kids, then in that case, even if he is having a 3 or 4 type category 4 varicocele, there is no need for any operation.
Thank you, doctor. And moving forward to our next question, someone is asking, I am diagnosed of chronic prostatitis and BPH since 8 years, and my age is 37 years. Does it has link with cancer in the future?
Well, chronic prostatitis literature proves that yes, chronic prostatitis have some risk of developing into CA prostate. So this patient has to be on annual screening. And why it is like that? Because in prostatitis, anytime he can go into acute or subacute prostatitis on chronic prostatitis, and it can raise the PSA. And because of raised PSA, we sometimes ask him to do a prostatic biopsies, and the prostatic biopsies can find out prostatic cancer. So there is two-way theory. One, yes, chronic prostatitis increases the risk, and sometimes because we are doing biopsies in these cases to find out the reason of raised PSA, and we are able to find out indolent CA prostate.
And moving forward, sometimes someone is asking, sometimes sperm ejaculate after urine. I consulted many doctors and they said it's normal. Do you have any advice for that or any thoughts regarding this?
Yes, this is normal in a male who is either unmarried, and to those married male whose spouse is not living with them, it is very much normal because sperm has to come out. Okay, so if he is not doing any sexual activity, or he is giving a very long period of time in doing the sexual activity, the semen will go with the urine.
And also, doctor, please elaborate how males who have undergone IVF, which is males are only contributing semen in this process, are at risk of prostate cancer.
Well, it is still in a theoretical thing because of some mutation and some genetical defects which we cannot picked up during the IVF thing. This is the reason why the baby born because of that IVF has more chance of CA prostate. But still, theory and researches are going on. Still, it's not in the guidelines.
Mm-hmm, mm-hmm. And someone is inquiring, they did the scan and the doctor said everything is all right, but the patient has prostate, everything is right on the prostate area, but patient has repeated stomach pain and constipation kind of issue. So what do you think is the reason behind that?
Well, if somebody is having a lower abdominal pain or pelvic and perineal pain, it's not only because of the prostate or the bladder. There are many other things which are in the pelvic area, like ball, rectum, colon. So it can be irritable bowel syndrome, it can be musculoskeletal, it can be other thing, but only on the basis of ultrasound we cannot diagnose prostatic problem. We have to seek the history, we have to do the physical examination, we have to do some investigations accordingly, and then we have to diagnose the disease.
Mm-hmm, mm-hmm. And someone is inquiring, how will I know if the cancer came back and what symptoms should I watch for someone who already has prostate cancer or who was treated of prostate cancer?
Excellent question. Actually, issue is that once we have diagnosed that somebody is having a prostate cancer, and for example, for say he has done a radiotherapy for that prostate cancer or radical prostatectomy for that prostate cancer, and after 2 or 3 months treatment, we will do the PSA test again, and that PSA is called the Nader PSA, and that Nader PSA means this is the baseline PSA. Now we have to see that this PSA is, and we will serially follow up this PSA, and we will see that if the PSA is going up or not. If the PSA test is going up, and then we will do a PET PSMA test and PET scan test or MRI in the area to find out that is the localized prostate cancer is recurrent, or is there any metastatic deposit of the prostate cancer or not.
Mm-hmm. Yes, yes. And regarding the treatment of prostate cancer, what are the potential side effects of prostate cancer treatment?
Well, prostate cancer depends, treatment depends, it varies. For example, if we are giving hormonal therapy, definitely it's a anti-testosterone therapy. There will be a gynecomastia, and that gynecomastia will be painful gynecomastia, low sexual drive, low erection, erectile dysfunction. So these kind of symptoms can happen because of the hormonal treatment. But if we will go for the chemotherapy, definitely chemotherapy is through the IV, and there are alopecia and body aches and colon things. And if we are going for the radiotherapy, then definitely there will be a radiation related side effects. So it
Mm-hmm.
varies.
Mm-hmm. Mm-hmm. And how often should someone screen if they have a family history of prostate cancer?
Yes, I have already mentioned in my slides that if somebody is having a first degree relative,
Mm-hmm.
especially the father or the forefather have diagnosed CA prostate at the age of 55 or before, then they have to start their screening at the age of 45. And every year they have to do the screening.
Mm-hmm. Mm-hmm. And what are the causes of an enlarged prostate?
What are the causes of enlarged prostate? Mostly there are two causes of enlarged prostate. One is enlarged prostate because of the age, and second is sometimes because of the cancer of prostate.
Mm-hmm. Mm-hmm. And for the treatment of prostate cancer, is it better to have radiotherapy or chemotherapy?
For the cancer of prostate,
Yes.
chemotherapy is basically in the advanced stage, not
Mm-hmm.
offered to everybody. In the initial stages, either radiotherapy or radical prostatectomy. Results of both the things are equivocal. Okay, so we have to judge And especially we have to see in this cancer that we have to foresee that this patient will survive 10 years beyond that age or not. For example, if we'll diagnose this cancer of prostate in an age of 82, then we will see that this patient can survive by 92 or not, if there is so many comorbidities or not. So we have to be cautiously discuss with him, watchful waiting. We will discuss options of radical prostatectomy and radiotherapy. So all the options will be discussed and depending upon the patient to patient.
And someone is inquiring, weak urine flow, back pain with an enlarged prostate. Is it likely to indicate prostate cancer?
Normally, prostate cancer does not present with any symptoms. In my slides, I have shown that prostate cancer is in the periphery. Normally, it will never present with any symptoms. It is a silently present. So if there is any symptoms, majority of them don't have prostate cancer. They have enlarged prostate because of the aging. So they have to come to the urologist. We have to do the uroflowmetry test. We have to do finger examination test, digital rectal examination, and do the ultrasound and try to find out the reason.
And is vasectomy safe? Any side effects? And will it affect my normal family life?
Vasectomy.
Yes.
Vasectomy is very much safe. As far as the procedure is concerned, it's safe, yes. But second thing is that if somebody's family is complete, vasectomy can be done. But I think it's reversal of vasectomy is even in the good hands is difficult. There is still infertility after that. So one should opt once they have made their mind.
And moving forward to our next question, my urine flow is low and prostate is checked and it's okay. Sugar and blood reports are normal. How can I increase urine flow? And please let me know precautions to avoid prostate enlargement.
Oh, very good question. There is no precaution to tell my patient at this point in time to have to not to have enlarged prostate, because prostate will enlarge with age. It's just like our hair are getting gray. We cannot prevent somebody's hair will gray at the age of 20, 25 as well. Second part of this question, that his uroflow is weak and prostate is fine. So there can be, and blood sugar is also fine. So there can be other reasons of weak flow. Maybe neurogenic bladder, maybe urethral stricture, maybe he's having any spinal problem. And second thing, which is very much important, that size of the prostate does not matter. We are assessing the size of the prostate by means of ultrasound. Sometimes what happens is that the prostate is very hard, inconsistency. Hard prostate, even if it is 20, 22 ml, it will compress the urethra and it will cause the weak uroflow. The patient will pass urine with difficulty. Patient will have to strain to pass urine. Patient will have feeling of incomplete evacuation. So all these symptoms will be there. So he has to see the urologist, and maybe he will be benefited by some alpha blocker.
And what are the no, sorry, doctor. When to start screening for prostate cancer?
I have already told, if there is an average risk factor. Average risk factor means that if there is no cancer history in the family, first degree relative cancer history in the family, the person should start at the age of 50. Okay, I'm seeing in my clinic that some patients are coming at the age of 35 and 40 as well, and they are saying that we have heard that we have to start screening. So normally we are not offering, even in the West, even in the America, they are not screening at the age of 35, 40. So screening start at the age of 50. And if there is a high risk group like some BRCA gene defect, if African American Caucasian patients, and if there is first degree relative cancer of prostate present in the family, especially diagnosed at the age of before 55, then they have to start screening at the age of 45, and then yearly, every yearly.
And is there any vaccine for prostate cancer or BPH?
Sorry, say it again.
Is there any vaccine for prostate cancer or BPH?
No, still there is no cancer vaccine, prostate cancer vaccine, or there is no BPH vaccine.
And someone is inquiring, my father has high PSA above 7, which is variable over different periods. However, there is no diagnosis for cancer, and he has been informed that it is not cancer after undergoing several advanced testing as well. What is your opinion on this?
He has done the prostatic biopsy as well.
No, it's not mentioned here.
Can you repeat the question again?
Oh, okay,
The
I
first
will
part?
repeat it. Okay. My father has high PSA above 7, which is
Yes.
variable over different periods.
Mm.
However, there is no diagnosis for cancer, and he has been informed that it is not cancer after undergoing several advanced testing. What
Yes.
is your
Yes.
opinion on this?
Thanks for repeating the question. What I can gather it that advanced investigation means biopsy. For example, if these kind of patients come to me with a 7 or above 7 nanogram per deciliter of PSA, then I
Mhm,
have to do the free PSA. Okay, and I will give an antibiotic trial because PSA is not sensitive,
mhm,
not 100% sensitive. It's around 45-50% sensitive. Sensitive means giving me a diagnosis that there is a cancer in the patient. Specific means cancer is not there in that patient, and it is PSA is around 55% sensitive. Then I will do a digital rectal examination and I will give him an antibiotic trial for 21 days because PSA can be raised because of many other reasons like acute or chronic prostatitis, any fever, any digital rectal examination, any instrumentation in the urological instrumentation, heart feces, constipation, fever because of unknown origin. 21 days trial, we will repeat the PSA test again with free PSA, and if the digital rectal examination is normal or if the digital rectal examination is abnormal, then we will go ahead for the MRI.
mhm.
If the
And
PSA test, sorry, if the
okay.
20 after and so and after 21 days, if the PSA is still not coming down to the normal range, then we have to see the PSA ratio. And according to the American guidelines, if somebody's PSA ratio is less than 18, most likely he's having cancer of prostate. If somebody is cancer of PSA ratio is from 18 to 24, it's a gray zone. And above 24, most likely he is not having cancer of prostate. Then we have to do the MRI, and if MRI is suggestive, then it's okay. If MRI is not suggestive, still we have to go ahead for the prostatic biopsy. Again, I have told you that there are two ways of prostatic biopsies: transrectal prostatic biopsies and transperineal prostatic biopsies. So biopsy is still also not 100% reliable test because we can miss. Biopsy is a needle biopsies. We can take it from 12, 14 different places. But as MRI is not suggestive, as ultrasound is not suggestive, so maybe we are not able to pick that area where the cancer is harboring inside the prostate. So biopsy is also not 100% reliable, but at least we have to do a diagnostic test.
And is being single or having no sexual partner at high risk of prostate problems?
Yes, very good question. Only thing which can prevent, which is in the literature, which shows that prostate cancer, that thing is preventive. Prevention of the cancer of prostate is the sexual activity. Literature says that if somebody who is doing 3 to 5 times sexual activity till the age of 50-55 years, most likely he will not have cancer of prostate.
And moving
But
forward to
still, it's
our
not in the guidelines.
okay, okay, sure. Moving on to our next question. When I urinate standing, the flow is very less and it runs in two streams. Moreover, if I urinate at night, it burns a lot. Are these symptoms of prostate dysfunction?
Can be, yes. Burning in the urine, weak stream, stream with two streams, all are can be because of the urethra, can be because of the prostate, can be because of the bladder. So this patient needs complete workup. So he has to come to the urologist.
Mhm. And when do you scan for prostate cancer with MRI instead of ultrasound? And does it depend on the PSA value?
Um, Yes, whenever we have to make a diagnosis, especially when we plan to do prostatic biopsy, we have to do the MRI. Previously in the guidelines, it was that we have to do MRI for before the redo biopsies, prostatic biopsies. Now in 2022, before the redo biopsy, before the first biopsy, we have to do the prostatic MRI panels.
And is it possible for prostate cancer to show through blood test?
Serum PSA, yes. Not 100% reliable, but yes, if somebody's PSA is around above 10, then we can think or suggestive of CA prostate.
And what treatment is good treatment for prostate enlargement in initial stage?
See, we have to do the IPSS scoring system for all the patients who are coming to our clinic. This is the questionnaire, and depending upon this questionnaire, if the prostate is enlarged but is not causing any obstruction, there is mild to minimal symptoms, we just have to watch, okay, watchful waiting. And in medium type of symptoms, we can start with alpha blocker or herbal treatment, or in advanced stages, or if the patient is having other reasons, then we can offer prostatic operations as well.
Mm-hmm. And so, doctor, we will have here our last question. Do we have like a specific diet to follow to prevent or to avoid prostate cancer or prostate issues in general?
As I've told you that there is no diet which can prevent enlarged prostate secondary to aging. Yes, but the diet, we should eat healthy diet containing a lot of fruits, vegetables, avoid smoking, avoid drinking. These are the risk factors for cancer of prostate and
For
generally all the
Mhm.
cancers.
Yeah, for physical activity, is there something to avoid for physical activity?
Ideally, we have to do a physical activity. Biking has associated with prostatitis and prostatic symptoms, but otherwise, all kind of physical activity we should have to do it. At least 3 times per week, exercise is recommended.
Mm-hmm. Thank you, doctor.
Most.
Thank you. This is our last question for today. Thank you very much for such an informative presentation.
Thank you, Aisha. Thank you. Thank
Thank,
you, Daman team.
Thank you. And if whoever missed our webinar for today, you can find the reply in Daman YouTube channel. Thank you everyone who joined us today. I hope we get the maximum benefit from our lecture today. See you inshallah in another webinar. Stay safe.
Okay, actually, somebody has asked me to repeat the first 10 slides. So is this possible that I can repeat the first 10 slides?
Can you do it, doctor, in 10 minutes? Is it possible?
Yes, yes. I can try to do it within 5, 6 minutes. No problem.
Okay, no problem with that.
Sure. Sure. Okay, the first slide is my learning objectives of today's talk. The objective of today's talk is first of all to highlight the health problems in men. I will then discuss the importance of early detection of disease by means of screening with a special focus on prostate cancer. Lastly, we will briefly talk about the reproductive and sexual disorders affecting males. The common problems that can affect male include cardiovascular diseases such as hypertension, or commonly called high blood pressure, high cholesterol, obesity, and the risk of heart diseases, example heart attack. Diabetes is also a common condition that is in fact taking a form of global epidemic. That's basically because of our lifestyle and dietary habits. Common cancers in males include cancers of lung, intestine, and prostate. Then there are mental and reproductive health issues, which are increasing in incidence because of the stressful lifestyle and changes in society. So there are some risk factors which we can avoid, like obesity, stress, smoking, diet, high salt and high sugar intake, sedentary routine, and personal hygiene. Some risk factors which we cannot avoid includes age, gender, and genetics, which we are getting it from our father and forefathers. So screening test includes, we have to include screening test for some population, and then we have to select some patients to do some more further testing to find out that whether we have to do some treatment or not to do any treatment or to keep him on watchful waiting. Now I will talk about the important aspect of screening. So I will discuss how an individual has to be screened for cardiovascular risk and cancers. Then I will discuss in bit detail about the prostate cancer, that what it is and how it presents and how early screening and detection can make a big difference. So blood pressure screening should start at the age of 18 years, and thereafter, according to the risk factors like presence of diabetes, family history, obesity, etc., we have to screen serially. Similarly, lipids are checked from 17 to 21 years of age initially, and further testing again depends upon the risk factors. Diabetes and obesity, as I mentioned earlier, has been taken a form of epidemic, so an yearly assessment is warranted for them. According to the American Cancer Society, the four cancers behind the prostate cancer is lung cancer, colorectal cancer, bladder, and melanoma. So in UAE, the prostate cancer is the leading cause. There are certain general rules and advice for cancer prevention that basically focus on a healthy lifestyle, like avoid smoking, alcohol, maintain a healthy weight, do physical exercises at least 3 times per week, increase intake of fresh fruits and vegetables, etc., and avoid sexually transmitted infections, STIs. Colorectal cancer starts, we have to do a fecal occult blood test at the age of 45 years, and then colonoscopy. Screening should be continued every 10 years. For lung cancers, the high-risk groups are the current smokers or the smokers who have quit smoking 15 years back. We have to start screening at the age of 50 and continue till 80, and annual screening with the low-dose helical CT is advisable. I think 10 slides has been done. So if you want furthermore, just let me know. Thank you.
Thank you, Doctor, again for joining us today, and special thanks to our audience. Anyone who missed the webinar today can find the replay on the Daman YouTube channel. Thank you, everybody, again. Stay safe and enjoy the rest of the day.
Thank you, Aisha. Thank you. Bye-bye.
Hello, I'm Manal.
Welcome to the weekly Daman Heroes workout with me, Chris, and
Alice. This is Indo with Tariq.
This is Omar, and welcome to this workout session.
oh, he's not facing. Come on back. So what makes us happy is doing this with Daman Heroes, sharing it with you, having fun together.
Make sure to subscribe to the channel and activate your notification by clicking on the bell.
And hope to see you back here soon.